I've been an ER doctor at Methodist Hospital in Peoria, Illinois for 17 years. You learn to trust your instincts in this job. You learn to read monitors, not miracles. But what happened that Tuesday night in February, I still can't explain it. And I'm not sure I want to. It was 11:47 p.m. when the ambulance brought him in. Gerald Hoffman, 73 years old, collapsed in his kitchen while making tea. His wife found him on the linoleum, eyes open, staring at nothing. No pulse when the paramedics arrived. They'd been doing CPR for 6 minutes straight. We took over immediately. I remember the fluorescent lights humming overhead, that sterile smell of disinfectant mixing with something else. Something metallic. The crash cart beeped its monotone rhythm while we worked. Chest compressions. Another round of epinephrine. His skin had that gray-blue tint, the color of gone. "How long?" I asked. "Total downtime's pushing 9 minutes," said Travis, one of our veteran paramedics. His face was slick with sweat. 9 minutes. The brain starts dying at 6. I called it. Time of death, 23:52. That's when Hoffman's wife started sobbing in the hallway. Not the theatrical kind of crying you sometimes see. This was the sound of something breaking. Small, quiet, final. I could hear it through the door, and I felt that familiar weight in my chest. The one that never really goes away. But we kept working. Sometimes you do one more round. Just one more. Call it stubbornness. Call it hope. At 23:54, his finger twitched. "Wait," said Brenda, our lead nurse. She'd been reaching for the sheet. Then his chest rose. Not the mechanical rise from compressions. This was different. Autonomous. His eyes snapped open, and he sucked in air like a drowning man breaking the surface. The monitor exploded with beeps. Sinus rhythm, strong and steady. Impossible, but there it was. I've seen spontaneous returns before. Rare, but they happen. What I hadn't seen was what came next. Hoffman sat up, straight up. No confusion, no disorientation. He looked around the room with perfect clarity, his eyes landing on each of us. "Dr. Reese," he said, reading my name tag. Then he turned. "Brenda, Travis." He knew. All of us. "Mr. Hoffman, please lie back down," I said, hands up, trying to keep my voice steady. But he wasn't looking at me anymore. He was staring at the door, at the small window in the upper half. "She's coming," he whispered. "Tell her not to. Tell Jenny not to come in here." I turned. Through the window, I could see Jenny Kowalski walking down the hallway toward our room. She was on night rotation, probably coming to assist with the next patient. I'd worked with Jenny for 3 years. Solid nurse, quiet, always brought homemade cookies on Fridays. Hoffman's hand shot out and grabbed my wrist. His grip was cold. Too cold. "She shouldn't be here, doctor. She dies next week." The room went silent except for the monitors. Brenda took a step back. Travis's jaw tightened. "Mr. Hoffman," I said slowly, pulling my hand free. "You've just experienced a severe cardiac event. You're disoriented. That's normal." He smiled then. Not the confused smile of a recovering patient. Something else. Serene, almost pitying. "I saw where I went. I saw where everyone goes, and I saw her there. 7 days, Red Honda Civic, Route 116, just past the Morrison exit. She won't feel anything. That's the mercy of it. Jenny opened the door. Dr. Reese, they need you in. She stopped when she saw Hoffman staring at her. Is everything okay? Don't drive Route 116 next week, Hoffman said. Take Farmington Road instead, please. Jenny laughed nervously. What? He's had an unusual reaction to resuscitation, I said quickly. Jenny, can you check on room 4? She left. I could see the confusion on her face as she walked away. We ran every test, CT scans, full cardiac workup, neurological assessment. Hoffman was, by all measurable standards, fine. Better than fine. His vitals were stronger than they had any right to be for someone who'd been dead 4 minutes ago. The internal bleeding we'd initially noted, a ruptured aortic aneurysm, had somehow stabilized, not healed. That's impossible. But stabilized enough that he should have been in screaming agony. Instead, he lay in bed, calm, asking for tea. Over the next 7 days, I checked on him constantly. He never mentioned Jenny again, never mentioned what he'd said. He talked about his grandchildren, about the Cubs' chances next season, about normal things. But there was something in his eyes, a distance, like he was looking through you at something just beyond. I tried to warn Jenny anyway, subtly, asked her to take different routes to work. She probably thought I was losing it. February 24th. I was in my office doing paperwork when I heard the commotion. Nurses running, someone crying. I already knew before I got there. Car accident, Route 116, red Honda Civic. Jenny Kowalski, dead on impact. They told me about it at 2:17 p.m. I went straight to Hoffman's room. He was lying in bed, eyes closed, smiling. The monitors showed flatline. The nurse said he'd passed about an hour ago. Peaceful, no pain, despite the aneurysm that should have killed him in agony. She said just before he went, he'd opened his eyes and said, "Tell Dr. Reese I'm sorry. We're only allowed to warn them. We're never allowed to save them." I held Jenny's funeral on Saturday. I watched them lower her into the ground at Resurrection Cemetery, and I wondered what Hoffman saw in those 4 minutes. What door opened? What he brought back with him? Because here's what keeps me up at night. He didn't die from the aneurysm. The autopsy showed it was still there, still ruptured, still bleeding. He should have been dead on arrival. But he stayed alive for exactly 7 days. Just long enough to warn her. Just long enough to fail. I'm still at Methodist, still working the ER. And sometimes, late at night when the hospital goes quiet, I wonder how many other patients have come back from those 4 minutes with knowledge they can't use. Warnings they're forced to deliver. Messages from wherever Hoffman went. I don't know why he could see Jenny's death. I don't know the rules of whatever allowed him to stay. But I know this. He smiled when he died. Like he'd been waiting for permission to let go. Like his job was finally done. And I still don't know if that's mercy or something far worse. People think silence is the absence of sound. But when you work the night shift at a hospital morgue, you learn that silence has texture. Weight. It presses against your eardrums like water. And sometimes, not often, but sometimes it moves. I'm Dr. Lena Frost. I've been a pathologist at Sao Paulo Central Hospital for 9 years, and I've learned to be comfortable with the dead. They don't judge. They don't complain. They simply wait. Most nights, the basement level where I work is just fluorescent lights, stainless steel, and the low hum of refrigeration units. Most nights, I'm alone with my paperwork and the quiet company of bodies waiting to tell their final stories. But there are other nights. Nights when I hear footsteps in the hallway and find no one there. Nights when the temperature drops in a room for no reason the HVAC system can explain. Nights when I catch movement in my peripheral vision, just a flicker, like someone ducking behind a corner. But when I look, there's only empty space and that textured silence pressing back. I used to dismiss these moments. Fatigue, stress, the mind playing tricks in a place where death is routine. But then I met Rita Salazar, the night security guard who's been here twice as long as I have. One night, about 3 years ago, she came down to check on me around 2 a.m. and found me standing in the hallway, staring at the fire door. "You saw someone?" she said. Not a question. I nodded slowly. A man, gray jacket. He walked through that door. And when you followed? Nothing. The stairwell was empty. No footsteps. No doors closing above. Rita's face didn't change. Last week, I watched a woman in a yellow dress walk into the women's restroom on this level. I called out, followed her in. Every stall was empty. The window hasn't opened in years. She paused. This place remembers people. And sometimes, I think they remember their way back. After that conversation, I started paying attention differently. Not with fear exactly. More like respect. Like acknowledging you share a space with something you can't fully understand. The first time it became personal was 6 months ago. A colleague, Dr. Felipe Ramos, called me at 3:47 a.m. on my night off. His voice was shaking. "Lena, I need you to listen to me. I'm in the morgue right now, and I just heard someone say my name." "Felipe, you're alone down there?" "That's the problem. I know I'm alone. I checked every drawer, every room, but I heard it, clear as I'm hearing you now. A woman's voice. She said, 'Felipe, he's coming.' I told him to leave. Get upstairs." He laughed, nervous. "I feel stupid now. I'm a doctor. I'm a rational man." "Rationality and intuition aren't enemies," I said. "If something feels wrong, trust it." He went upstairs, filed his report. We never talked about it again. 2 weeks later, Felipe's car was hit by a drunk driver on the marginal Tietê. He survived, but barely. When I visited him in the ICU, tubes running into his arms and a ventilator breathing for him, he couldn't speak. But his eyes found mine, and I saw recognition there. Terror, maybe. Or understanding. I thought about that night constantly, about warnings, about voices in empty rooms. Then came September 14th. The ambulance brought her in at 11:23 p.m. Jane Doe. Hit-and-run victim. Young woman, maybe 25. No ID, no phone. Her clothes were torn, her body broken in ways that made my chest tighten. fixed and dilated pupils. No pulse, no respiratory effort. The ER doctor, Dr. Camila Torres, pronounced her dead at 11:41 p.m. and sent her down to me. I remember the smell when they wheeled her in. Rain and asphalt. Her dark hair was matted with blood. Her face, despite the trauma, was peaceful, almost serene. I logged her in, took photographs, drew blood for toxicology, standard procedure. She was cold to the touch, not just dead cold, but something deeper. The kind of cold that settles into your own fingers and doesn't leave. I placed her in drawer 7 and went back to my office to start the paperwork. That's when the power flickered, just once. The lights dimmed, the refrigeration units hummed louder for a moment, then everything normalized. I looked at the clock. 1:34 a.m. The silence that followed felt wrong. Too thick, like it was holding its breath. I heard the sound of metal sliding, slow, deliberate. I stood up, walked back into the main room. The drawer, number 7, was open. Not all the way. Just 6 inches. Enough. My hands were steady as I approached. Training takes over in moments like this. Check the mechanism, check the locks. Rational explanations first. But when I pulled the drawer open fully, she was sitting up. Not struggling, not gasping, just sitting, upright, eyes open, staring at the far wall where there was nothing but white tile and a clock showing 1:37 a.m. I couldn't breathe, couldn't move. The fluorescent lights hummed overhead. My heart hammered so hard I could hear it in my ears. "Miss?" My voice cracked. "Can you hear me?" She turned her head, slowly, mechanically. Her eyes found mine, and they were completely black. Not the pupils, everything. Like someone had poured ink behind the irises. When she spoke, her voice was flat, emotionless. "He followed me here." "Who followed you?" But she was already lying back down, smoothly, deliberately, like a recording playing in reverse. Her eyes closed. Her chest stopped moving. I don't think it had ever started. I hit the emergency button, called Dr. Torres, called Rita. By the time they arrived, 3 minutes later, I was standing 10 feet away from the drawer, shaking. Torres checked her, confirmed what I already knew. Dead. Again, officially, finally. We pulled the security footage. Rita, Torres, and I watched it together in the surveillance room at 4 a.m. while maintenance workers checked the drawer mechanisms and the morning shift started filtering in upstairs. The timestamp showed 1:34:52. The drawer slid open. 6 inches. Just like I'd said. But here's what made my blood run cold. On the footage, the woman never sat up. The drawer stayed closed after that initial opening. At 1:37:19, you could see me enter the frame, approach the drawer, and pull it fully open. You could see me stumble backward, see my mouth move as I spoke to nothing. The woman was lying flat the entire time. "The camera must have glitched," Torres said. But her voice wasn't convincing anyone. Rita said nothing. She just kept watching the footage, her face unreadable. They asked me to write a report. I did. I included everything except the black eyes and the voice. Some truths don't belong in official documents. The footage was archived. Or it was supposed to be. When I tried to access it 2 days later, the file was gone. corrupted according to IT. No backup, no recovery possible. The autopsy showed massive internal trauma, ruptured organs, severe brain damage. She'd been dead before she ever reached the ER. There was no medical explanation for temporary revival. None. We never identified her. No missing persons report matched. No one came looking. She's buried now in the municipal cemetery, plot 447, under a marker that reads, Unknown Woman, September 14th, 2024. I attended the burial. I was the only one there besides the gravediggers. I still work the night shift. I still hear footsteps in empty hallways. But now, when I arrive at the morgue, I say good evening to the silence. When I leave, I say good night. Rita does the same. We never discussed why we started doing this. We just did. Because here's what I know now: the dead don't always leave. Some of them can't. Some of them are running from something. And when they tell you someone followed them, when they use their last impossible breath to warn you, you don't ignore it. I still think about her words. He followed me here. Not he's following me. Past tense. He followed. He arrived, sometimes late at night when the silence gets too heavy. I wonder if he's still here, if he found what he was looking for. And I wonder, because I can't help it, if the next time that drawer slides open in the dark, it won't be her sitting up. It'll be me. And I'll finally understand what she was running from. There are things you learn to carry in pediatric emergency medicine. The weight of a child's body when you're doing compressions. The particular sound a mother makes when you tell her you did everything you could. The smell of smoke in a patient's hair that lingers on your scrubs long after your shift ends. And sometimes, if you're unlucky like me, you carry ghosts. I'm Dr. Nate Sullivan. Been working pediatric ER at Houston Methodist for 14 years. Before that, I worked in Austin. I don't talk about why I left Austin, but on nights like the one I'm about to tell you about, the past has a way of finding you anyway. It was March 17th. I remember because my daughter had called that morning to remind me about her spring recital. I'd promised to be there. I'm always promising to be there. The ER doesn't care much about promises. The call came in at 8:43 p.m. House fire on Westheimer Road, multiple casualties, one pediatric patient en route. 6 years old, male, severe smoke inhalation. Smoke inhalation is one of those injuries that sounds straightforward, but isn't. When you breathe in smoke, you're not just getting carbon monoxide poisoning, though that's bad enough, starving your blood cells of oxygen. You're also getting superheated air that burns the inside of your throat and lungs. Chemical irritants from whatever's burning, plastics, furniture, God knows what. And you're getting particulates, actual solid matter coating the airways. It's like inhaling fire and ash and poison all at once. Kids are especially vulnerable because their airways are smaller. Less room for swelling before they can't breathe at all. The paramedics wheeled him in at 8:56 p.m. His name was Liam Crawford. Soot covered his face in dark smudges. His lips had that cherry red color that signals carbon monoxide. His breathing was labored. You could hear the stridor, that high-pitched wheezing sound that means the airway is closing up. His oxygen saturation was 84%. Anything under 90% is dangerous. Under 85% is critical. Parents? I asked. Mother's coming in the second ambulance, said Rita, one of the paramedics. Father didn't make it out. I nodded. Didn't let myself think about what that meant. Not yet. There'd be time for that later. We got Liam on the table. Started high-flow oxygen through a non-rebreather mask. Pushed IV fluids. His lungs sounded like crackling paper when I listened with my stethoscope. Rails. Fluid accumulation. I could see the redness in his throat when I checked his airway. He was conscious but drifting, eyes rolling back, then forward. In and out. Fighting to stay present. Liam, can you hear me? I kept my voice steady. Calm. You're in the hospital. We're taking care of you. His eyes found mine, unfocused, scared. Your mom is coming, I said. She's going to be right here soon. He tried to speak but started coughing. Thick, black sputum. His oxygen dropped to 81%. His heart rate was climbing. 142 beats per minute. His little body was working so hard just to breathe. We need to intubate, I told Jenna, the nurse beside me. Get me a size 5.0 cuffed tube. We moved fast. In pediatric emergency medicine, you learn that kids don't decline gradually like adults. They compensate until they can't anymore, and then they crash hard and fast. Liam was approaching that edge. I was prepping the intubation equipment when his hand shot out and grabbed my wrist. His grip was weak, but deliberate. His eyes were suddenly clear, focused. Not the unfocused gaze of a child slipping toward unconsciousness. Something else. Dr. Sullivan, he said. His voice was raspy, damaged by smoke, but the words were perfectly clear. I froze. I hadn't told him my name. My badge was clipped to my coat, but his eyes hadn't looked down. Hadn't looked at anything except my face. Your son says you didn't check under the bed. The room went silent. Or maybe I just stopped hearing anything except those words echoing in my head. The monitor was still beeping. Jenna was still moving beside me. But I couldn't process any of it. What did you say? My voice came out strangled. Liam's eyes held mine. There was something in them, something old, something that didn't belong in a 6-year-old's face. He says it's okay. He says you couldn't have known. My son, Jamie. He'd been 4 years old when the fire took him, 3 years ago. October 12th. I'd been working a double shift. My wife, ex-wife now, had put him to bed. Standard routine. Story, kiss, lights out. At 2:37 a.m., smoke detectors went off. By the time she got to his room, the fire had already consumed half of it. The investigation later determined it started under his bed, a 9-volt battery. Must have fallen out of a toy, made contact with a metal object, probably a forgotten coin or paper clip. Batteries can short-circuit like that, heat up, ignite whatever's around them. Blankets, dust, carpet. I'd built that bed frame, installed it myself. I'd swept under it 100 times, but never thought to check for something like that. Something so small, so impossible. No one knew about the battery except the fire marshal, my ex-wife, and me. We never told anyone, couldn't bear to hear people say what we already knew. Should have been more careful. Should have checked. Liam, I managed. My hands were shaking. Who told you? But his eyes were rolling back. His oxygen was at 78%. His lips were turning blue. Code blue! Jenna's voice cut through. We moved into emergency protocol. I intubated him. Got the breathing tube in on the first try despite my shaking hands. Bagged him manually. Pushed epinephrine. Started compressions. Jenna counted. I pressed down on his small chest, feeling the ribs flex under my palms, trying to force his heart to remember how to beat. His mother arrived during the code. I could hear her screaming in the hallway. Security was holding her back, not letting her see. That's protocol. But I could hear her anyway. That sound mothers make. We coded him for 43 minutes. Longer than we should have, longer than was reasonable. But I couldn't stop. Couldn't let go. Jenna put her hand on my shoulder at 9:52 p.m. Nate? He's gone. I called time of death at 9:54 p.m. We cleaned him up before we let his mother in. Removed the tubes, wiped the soot from his face, made him look peaceful. It's the last kindness we can offer. I stood in the hallway afterward while Jenna went in with the mother. The fluorescent lights hummed overhead. My scrub smelled like smoke. I could still feel where Liam's small hand had gripped my wrist. I went home that night at 2 a.m. Didn't go to bed. Instead, I pulled out the fire investigation report from the box I keep in my closet. The one I read every year on October 12th. The one that lists every detail of how Jamie died. Page 4. Item recovered from scene. 9-volt battery, located under bed frame, determined to be ignition source. No one could have known to check for that. No one could have predicted a battery would fall there, would make contact with exactly the right object, would short circuit at exactly the right moment. But I should have checked anyway. That's the thing that lives in my chest. The weight I carry. I should have checked. I never told anyone about what Liam said to me. How would I explain it? A dying child with smoke-damaged lungs, hallucinating my name and my deepest guilt. Coincidence? Delirium? Trauma? But here's what I can't stop thinking about. Liam didn't know my son's name. Didn't say Jamie, just said, your son. Like he was passing along a message from someone who couldn't deliver it himself. I still work pediatric ER. I still save some kids and lose others. I still carry that weight, but now, late at night when the ward is quiet and I'm writing my notes, I wonder about the space between alive and gone, about the things that move through that space, about messages that find their way through dying children's voices. And I wonder if Jamie really is okay, if he really forgives me, or if guilt just shapes itself into the absolution we need to keep going. Because here's the thing that keeps me awake. Whether that was my son's voice or my own desperate mind, the truth is still the same. I didn't check under the bed, and I never will get another chance to. The muddy footprints led away from the body. That's what I keep coming back to. Not the screaming, not the monitors going haywire, not even the fact that his eyes opened after the flatline. It's those footprints. Wet, dark, leading from the gurney where a dead man lay strapped down, across the sterile white floor of Trauma Bay 3, and stopping at the sealed emergency exit door. I'm Nurse Claire Dobson, and I've worked the night shift at Mount Sinai Hospital in Manhattan for 11 years. I've seen stabbings, overdoses, heart attacks in teenagers, and things that would make you stop sleeping at night. But January 8th, that was different. That was the night I learned that sometimes the body knows it's not done, even when every machine in the room says otherwise. It started at 1:47 a.m. Paramedics radioed ahead. Homeless male, approximately 60 years old, found unconscious in Bryant Park. Core body temperature was 86 degrees Fahrenheit. For context, normal body temperature is 98.6. Anything below 95 is hypothermia. Below 90, and your organs start shutting down. At 86, you're essentially freezing from the inside out. Your heart rhythm becomes unstable. Your blood pressure drops. Your brain stops working properly. Most people at that temperature are semi-conscious at best. But he was talking when they wheeled him in. "I can't go yet," he kept saying over and over. "They're waiting. I can't go yet." His name was Leonard Voss. Dr. Greg Finley and I got him onto the gurney. His skin was gray-blue, lips nearly purple. Ice crystals had formed in his scraggly beard. He'd been outside for hours in 20-degree weather, wearing nothing but a thin jacket and torn jeans. But that wasn't the worst of it. When we cut away his clothes, we found the blood. His abdomen was distended, rigid. Internal bleeding, significant. Dr. Finley's face went tight when he palpated the area. Possible splenic rupture. Could be liver damage. Get me a portable ultrasound. Internal bleeding is one of those silent killers. Your spleen or liver gets damaged, maybe from a fall, maybe from blunt trauma, and it starts bleeding into your abdominal cavity. No external wound, nothing you can see, just blood pooling inside you, and by the time symptoms show, you might have lost 2 or 3 liters. That's half the blood in your body. Leonard was in shock. Blood pressure was 70/40. Heart rate was 130, trying desperately to compensate for the volume he was losing. We started 2 large bore IVs, pushed warm saline. Called for O-negative blood. The ultrasound confirmed free fluid in the abdomen, lots of it. "We need to get him to surgery," Dr. Finley said. "Now!" But Leonard grabbed my wrist. His hand was so cold it burned. His eyes locked onto mine with an intensity that didn't match his vitals. Shouldn't have been possible for someone that close to dying. "They're waiting," he said. Clear as day. No slurring, no confusion. I promised I'd come back. "I can't go yet." "Sir, we're going to take care of you," I said, trying to sound reassuring. "You're going to be okay." He shook his head. Slow, deliberate. "You don't understand. They won't let me go until I do." His blood pressure dropped to 60/35. The monitor started alarming. His heart rate climbed to 145, then 160. Then suddenly, nothing. Flatline. "Starting compressions." Finley climbed onto the gurney, began chest compressions. I grabbed the crash cart. We pushed epinephrine, 1 milligram, then another. I bagged him manually, forcing air into his lungs. 30 compressions, 2 breaths. The rhythm we'd done 1,000 times. 3 minutes in, I checked for a pulse. Nothing. The monitor showed a systole. No electrical activity at all. A flat green line across the screen. That's when his eyes opened. Not gradually, not the fluttering you sometimes see when people are semi-conscious. They snapped open, wide, staring at the ceiling above the trauma bay lights with an expression of absolute terror. Then he started screaming. Not words, just this raw, primal sound that made my skin crawl. His arms came up. Shouldn't have been possible, we had restraints on. And he started clawing at the air above him, like he was fighting something. His fingers curled and grasped at nothing, pulling, desperate. "Leonard!" Dr. Finley shouted. "Leonard, look at me!" But Leonard wasn't looking at anything in the room. His eyes tracked something moving above us, something we couldn't see. His screaming turned into words. "No, no, I promised. I have to go back." The heart monitor suddenly spiked. Not a normal rhythm. Not something that happens when you push medication. It was chaotic, wild, going from flatline to ventricular tachycardia, a deadly fast rhythm without any intervention from us. I looked at Dr. Finley. "Did you push anything?" "Nothing. I didn't touch." The monitor shrieked. Leonard's back arched off the gurney. His hands stopped clawing, dropped to his sides. His eyes were still open, still staring at the ceiling. But the terror was gone, replaced by something worse. Resignation. The monitor went flat again, for real this time. We worked him for another 20 minutes, standard protocol. But I knew. We both knew. Whatever had been keeping Leonard Voss tethered to this world had finally let go. Dr. Finley called time of death at 2:34 a.m. We covered Leonard's body with a sheet. I started cleaning up the trauma bay while Dr. Finley went to do paperwork. Standard procedure. You clean, you reset, you prepare for the next one. That's when I saw them. Footprints, wet, muddy, leading from the gurney. I followed them with my eyes. They went across the clean white floor, the floor I'd just mopped an hour before Leonard arrived, and stopped at the emergency exit door, the door that was sealed from the inside, the door that would trigger an alarm if anyone opened it. My hands went cold. I checked the gurney. Leonard's body was still there, still strapped down. I could see the outline of his form under the sheet. But the footprints were there too, fresh. The kind of prints you get from muddy shoes walking across a clean floor. I called Dr. Finley back in. He stared at them for a long moment without saying anything. "Claire," he said finally, "when did maintenance come through?" "They didn't. I've been here the whole time." We pulled the security footage, hospital policy. Anything unusual gets documented. The timestamp showed 2:34:07, 7 seconds after Leonard was pronounced dead. On the grainy black and white footage, you could see the trauma bay, empty except for the gurney. Dr. Finley leaving the room, me standing there alone. And then, clear as day, footprints appearing on the floor, one after another, like invisible feet walking across the room. No source, no person, just prints materializing out of nothing. The footage showed me turning, following them with my eyes. You could see the exact moment I realized what I was looking at. The way I froze. We never filed an official report. What would we say? Instead, we mopped up the footprints, reset the room. Leonard's body went to the morgue and eventually to a city burial plot when no next of kin came forward. But here's what I learned from the social worker later. Leonard had a daughter. She'd been in a care facility upstate. severe dementia. He used to visit her every Sunday without fail, even when he lost his apartment and ended up on the streets. He'd promised her, back when she still recognized him, that he'd keep coming, that he'd never abandon her. She died on January 7th, the day before Leonard came into my ER. The facility had been trying to reach him, but he had no phone, no permanent address, no way to know she was gone. I think about those footprints a lot, about what Leonard was seeing when he stared at the ceiling, about what they were that he couldn't leave behind, about promises that tether us to this world, even when our bodies are ready to go. I still work the night shift, still see the impossible sometimes in the gaps between science and something else. And when I pass Trauma Bay 3, I sometimes pause and look at the floor. Because here's the question that won't leave me alone. If Leonard's body never moved from that gurney, whose feet made those prints? Was it Leonard finally freed? Or was it something else, something that had been waiting for him, finally walking away when the job was done? And the bigger question, when I die, what promises will I have made that might keep me here, clawing at the air, refusing to let go?